common problems in my practice, and it's gotten worse in recent years. I've been in practice 27.5 years, and I can see the changes in my own professional lifetime. One of the biggest issues now is insomnia. Even people who aren't cancer patients always have anxiety, but even people who aren't cancer patients will come in with their biggest complaint is sleep. They haven't slept well in years. They can't fall asleep. They wake up in the middle of the night. And melatonin is produced in the pineal. It's a wonderful hormone that's derived from the amino acid tryptophan through serotonin. It's very complex, but it's a wonderful hormone that's basically the sleep hormone that sets the sleep cycle in humans, and it's really very, very critical. And one of the problems with EMFs that I found, and I believe this to be the case, seen some research, is that EMFs disrupt melatonin, which shouldn't be that surprising. You know, the pineal, which sits in the middle of the brain, is a very small gland, but that's where melatonin is produced. And it's very responsive to light. I mean, it actually operates based on light. When the sun sets, normally, you know, we're designed that when the sun sets, we should go to bed. The pineal starts pouring out melatonin, and melatonin has a sedating effect. Not only does it have a sedating effect, it has a documented anti-cancer effect. In fact, there are clinics in Europe, conventional clinics, that will use 40 up to 80 milligrams of melatonin a day. A normal dose for sleep might be 1 or 2 milligrams. They're using high-dose melatonin effectively to treat cancer. It not only has a cancer protective effect, which has been documented particularly for things like breast cancer, but it has an anti-cancer effect and is being used in treatment regimens for cancer. Now, one of the problems with EMFs is it disrupts the pineal. And again, it shouldn't be surprising because the pineal is light responsive. Light is an electromagnetic energy. That's what it is. So the fact that EMFs are not going to disrupt the pineal is, you know, it's logical neurophysiologically. We would expect EMFs to disrupt, if anything else, the pineal, which exists to be sensitive to light. As the rays of light decrease, as night comes, the pineal turns on and sends off melatonin. Well, EMFs can mimic light. And the light that actually is, when the sun rises, we wake up because all light, whether it's synthetic, artificial, natural, or synthetic, gives off a blue wavelength. You can't see it, but all light has a blue wavelength that stimulates the wake-up center in the brain and shuts down melatonin. Now, blue light is an electromagnetic field. That's what it is. It's electromagnetic energy. Although it's called blue, you can't even see it. EMFs work like blue light. And they basically directly stimulate the pineal like the blue wavelength and turn off the pineal, shut down melatonin production, and disrupt sleep. And people will sleep lightly, or I have patients that they'll sleep 2 hours a night. It's because they're not producing any melatonin. Why? Well, they were on their computer all night, which gives them from the light, the blue light, but also the EMF, which works like a blue light. And that will disrupt the pineal and the production of melatonin, and it's increasing their cancer risk. There's no question that low melatonin levels are associated with increased levels of cancer, particularly hormone-dependent cancers like breast or prostate cancer. So there's no question that the EMFs are having a profound effect on the pineal, and as a result, a profound effect on sleep patterns. I mean, insomnia is epidemic. The costs of sleeping pills in the U.S. is in the billions, and it's among the most highly prescribed drugs. And what's the reason for that? It's the melatonin disruption. What's interesting is some of the newer drugs like Lunesta are actually trying to mimic the normal melatonin production and encourage melatonin production, because there's a much easier way of doing it, but it's not prescription. You take melatonin. Why take a drug to stimulate melatonin production when you can take melatonin? Or an even smarter way is to try and avoid EMFs, particularly late at night when you want to go to bed, because that's going to have the same effect as blue light and turn off the pineal, stimulate the active centers in the brain as if it were daylight, and you're not going to go to sleep. EMFs can have the same effect as full sunlight, even if you're in a completely dark room. You're not going to go to sleep. EMFs can have the same effect as full sunlight, even if you're in a completely dark room. That's why the sleep experts, even conventional sleep experts, tell people if you want to sleep well, keep all the electricity out of your room. Even conventional sleep center specialists, who notoriously are 100 years behind everything, are starting to tell patients you got to have no computers in the room, no iPhone, you can't be on your iPhone. The reason is not only the blue light from the light of the screen, which will stimulate the active centers, but the EMFs work like a blue light and shut off the pineal, shut off melatonin. If you think